The gleaming white corridor of the Stellaris research vessel was almost painfully bright to human eyes, Sarah Jenkins noted as she made her way toward the medical bay. The Cathars certainly had different preferences when it came to lighting, among many other things. As an experienced field medic with over 15 years of emergency response work on Earth, Sarah had seen her share of makeshift operating theaters in disaster zones and remote locations. Nothing, however, had prepared her for the sterile perfection of Cathar medical facilities. She paused at the entrance to the medical bay, taking a moment to compose herself before the automatic doors whisked open with a soft pneumatic hiss. Today marked her third week aboard the Stellaris as part of the pioneering interspecies medical exchange program. So far, her Cathar colleagues had been polite but distant, clearly struggling to reconcile their advanced medical philosophies with what they perceived as the primitive approaches of human medicine. The medical bay itself was a marvel of technology. Diagnostic beds equipped with molecular scanners lined one wall, each enclosed in what Sarah had learned were individual sterile force fields. Holographic displays hovered above each station, continuously updating with biometric data. In the center of the room, several Cathar students gathered around a three-dimensional projection of what appeared to be cellular structures, their slender fingers occasionally reaching through the hologram to manipulate the display. Taryn Jenkins, you have arrived precisely on schedule, came the precise, slightly metallic voice of senior instructor Forlag. The tall Cathar approached her with measured steps. Like all of his species, Forlag was remarkably thin by human standards, standing nearly 7 feet tall with pale, almost translucent skin that revealed the faint outlines of a circulatory system unlike anything seen on Earth. His large, almond-shaped eyes blinked vertically as he regarded her. Today's training session will focus on automated tissue sampling techniques. The students are eager to observe the adaptations required for varying physiologies. Sarah offered what she hoped was a respectful nod. I'm looking forward to it, senior instructor. Though I must admit, I'm still adjusting to how heavily your medical practices rely on automation. Forlag's head tilted slightly, the Cathar equivalent of raised eyebrows. Efficiency and precision are paramount in medical science, Taryn Jenkins. Manual intervention introduces unnecessary variables and contamination risks. He gestured toward the group of students. Please join us. Student Lyra has expressed particular interest in comparing Cathar and human emergency response protocols. As Sarah approached the group, one of the younger Cathar stepped forward. Lyra was distinctive among her classmates, with a slightly darker skin tone and unusually expressive features for her species. Taryn Jenkins, she greeted with a small bow. I have studied the historical archives of human field medicine with great interest. Your species' adaptability in suboptimal conditions is remarkable. Sarah couldn't help but smile at what was clearly intended as a compliment, despite its clinical delivery. Sometimes the simplest solutions are the most effective, especially when high-tech options aren't available, she replied, noting the slight widening of Lyra's eyes, a sign of curiosity, she'd learned. Before Lyra could respond, Forlag called the class to order. Today we will demonstrate the molecular extraction protocol using the new XR-7 automated sampling system, he announced, gesturing toward what looked to Sarah like an elaborate mechanical arm, ending in an array of impossibly fine needles and sensors. This system allows for minimal tissue disruption while collecting comprehensive biometric data. Student Lyra, please initialize the calibration sequence. As the students gathered around the device, Sarah observed their reverent handling of the equipment. Every movement was precise, every interaction with the technology practiced to perfection. She had noticed throughout her time aboard that the Cathar approached even minor medical procedures with an intensity that seemed disproportionate. A simple skin cell sample was treated with the same gravity as major surgery might be on Earth. The XR-7 significantly reduces sample collection trauma compared to previous models, Forlag was explaining as Lyra carefully adjusted settings on a holographic control panel. For species with delicate epithelial structures like our own, this represents a critical advancement in non-invasive diagnostics. Sarah stepped closer, genuinely interested. On Earth, we've been developing similar technologies for rapid field assessments, though not nearly as sophisticated as this. Our military medics still rely heavily on manual techniques combined with portable diagnostic equipment. Forlach's expression remained neutral, but Sarah detected the slight stiffening that indicated discomfort with the concept. Manual tissue sampling is inherently traumatic and imprecise, he stated. For Kthar physiology, such methods would be unacceptably dangerous due to our reduced coagulation capabilities and heightened inflammatory response. Different species, different approaches, Sarah acknowledged diplomatically. She'd quickly learned that the Kthar's extremely thin skin and complex immune system made them far more vulnerable to infection and injury than humans. What would be a minor scrape for a human could be a serious medical emergency for a Kthar. Their medical technology had evolved accordingly, prioritizing absolute sterility and minimal physical contact. Lyra had successfully calibrated the device and now looked to Forlag for further instruction. The system is ready, Senior Instructor. Shall we proceed with a demonstration using the synthetic tissue matrix? Actually, Forlag replied, I believe this presents an educational opportunity. Taryn Jenkins, would you consent to a tissue sample collection? The students would benefit greatly from observing the adaptations required for human physiology. Sarah hesitated only briefly. Of course, happy to help. She stepped forward, rolling up her sleeve to expose her forearm. The students murmured among themselves, their large eyes fixed on Sarah's arm with what seemed like a mixture of scientific curiosity and subtle apprehension. To them, human skin must appear incredibly thick and resilient compared to their own delicate tissue. Lyra approached with a sampling device, now emitting a soft blue glow. Please remain perfectly still, Taryn Jenkins. The XR-7 will create a sterile microfield around the sampling area and then extract approximately 3 microliters of tissue and interstitial fluid. Sarah nodded and held her position as instructed. She watched with professional interest as Lyra manipulated the controls with impressive dexterity. The mechanical arm extended smoothly toward her exposed skin, its array of instruments gleaming under the bright lights of the medical bay. What happened next occurred in a matter of seconds. A slight power fluctuation, barely noticeable except for a momentary dimming of the lights, caused a mechanical arm to jerk unexpectedly. Instead of the gentle touch of its sampling probe, one of the device's stabilizing edges scraped across Sarah's forearm, creating a clean 3-inch slice that immediately began to bleed. The reaction was instantaneous and overwhelming. Alarms blared throughout the medical bay, and the overhead lights shifted to a pulsing amber. The Kthar students recoiled in what appeared to be collective horror, several of them backing against the far wall with their hands raised protectively. Forlag's normally composed demeanor shattered as he barked rapid commands in the Kthar language. Sarah looked down at her arm with mild surprise. The cut was clean and straight, bleeding steadily but not profusely, a superficial wound that would require cleaning and a few stitches, nothing more. In her assessment, it barely qualified as a minor injury. It's okay, she began to say, but her voice was drowned out by the continuing alarms and the sudden appearance of what she could only assume was the Kthar equivalent of an emergency medical team, bursting through the doors with equipment she didn't recognize. Before she could protest, Sarah found herself being guided, almost forcibly, onto one of the diagnostic beds. The sterile force field hummed to life around her, and holographic displays exploded with data as multiple scanners passed over her body. Level 3 soft tissue trauma with potential vascular compromise. Forlag was announcing in a tone that suggested imminent catastrophe. Prepare for exploratory intervention and microvascular repair. Activate the Class 1 sterile protocols and initialize the surgical robotics. Sarah tried to sit up, only to be gently but firmly pressed back down by a medical restraint field. This really isn't necessary, she insisted, raising her voice to be heard over the continuing alarms. It's just a superficial cut. I've had worse shaving my legs. Her attempt at humor fell flat as Forelag approached the diagnostic bed, his expression grave. "Taryn Jenkins, you are experiencing a significant traumatic injury with active hemorrhage. Our scans indicate elevated stress markers in your system, consistent with the early stages of shock. Please remain calm while we prepare the surgical intervention." Sarah looked at her arm again, trying to see the injury through Kthar eyes. To a species with paper-thin skin and limited clotting abilities, perhaps this ordinary cut did look catastrophic. She needed to make them understand before they launched into an unnecessary procedure. "Senior Instructor Forelag," she said, deliberately keeping her voice steady and professional, "I appreciate your concern, but as a trained human medical professional, I can assure you that this injury requires only basic first aid. Human skin is much thicker than Kthar tissue, and our blood clotting mechanisms are highly efficient. This is genuinely a minor wound by human standards." Forelag barely acknowledged her words as he studied the holographic displays. "Blood loss continues at an alarming rate," he noted to the assembled team. "The scan indicates potential subcutaneous tissue damage extending to a depth of 2.3 millimeters. Risk of infection significant. Risk of scarring high. Prepare microregenerative field generators and vascular sealant applicators." The medical bay had transformed into a scene of controlled chaos as additional equipment was brought in. Sarah watched with growing frustration as robot arms deployed from the ceiling, bearing instruments she didn't recognize but that looked alarmingly sophisticated for what amounted to a glorified paper cut. From the corner of her eye, Sarah noticed Lyra standing slightly apart from the others, her head tilted in what Sarah had come to recognize as the Kthar expression of puzzlement. The young student was observing not the frantic preparations, but Sarah herself, noting her calm demeanor and apparent lack of distress despite what the Kthar considered a severe injury. "Senior Instructor," Lyra ventured hesitantly, "the Terran's vital signs appear remarkably stable for the reported severity of injury." Forelag barely glanced in Lyra's direction. "Different species, different responses, Student Lyra. Human physiological stress responses often manifest with delay. The data clearly indicates tissue trauma consistent with a level 3 injury according to our medical classification system." A three-dimensional image of Sarah's arm appeared above the bed, showing in exquisite detail the layers of skin, subcutaneous tissue, and the minor blood vessels damaged by the cut. To Sarah's experienced eye, it confirmed exactly what she already knew. This was a simple laceration requiring nothing more than cleaning and closure. As a team of Kthar medical technicians approached with what appeared to be a portable surgical unit, Sarah realized she needed to take more decisive action. Drawing on every bit of authority she had developed over 15 years in emergency medicine, she spoke in what her colleagues back on Earth called her command voice. "Stop." The word cut through the activity like a physical force. "As the patient and a certified medical professional, I am invoking Section 7, Paragraph 3 of the Interspecies Medical Exchange Charter, which guarantees patient autonomy in non-life-threatening situations." The room fell silent except for the soft hum of equipment. Forelag stared at her, his large eyes blinking rapidly. "This is not a life-threatening injury by human medical standards," Sarah continued firmly. "I am refusing the proposed surgical intervention and requesting instead that I be allowed to treat this injury using human medical protocols. I have my personal medical kit in my quarters. Student Lyra, would you please retrieve it for me?" For a moment, no one moved. The Kthar medical team looked to Forelag, clearly uncertain how to proceed in the face of this unprecedented situation. Forelag himself seemed caught between his medical training and the diplomatic implications of forcing treatment on an unwilling exchange participant. After what felt like an eternity, Lyra stepped forward. "I will retrieve your medical supplies, Taryn Jenkins," she said, and quickly left the medical bay before Forelag could object. The senior instructor approached Sarah's bed, his thin fingers moving restlessly at his sides, a sign of Kthar agitation. "Taryn Jenkins, our scans clearly indicate significant tissue damage that requires immediate intervention to prevent further deterioration. Your species' tendency toward biological stubbornness is well documented, but in this case, Sarah interrupted gently, you're applying Cthar medical standards to a human body. Our physiologies are fundamentally different. What constitutes severe trauma for your species is often a minor injury for humans. Please, allow me to demonstrate an appropriate human treatment protocol. Consider it part of the cultural exchange. Forlag's expression remained troubled, but something in his posture shifted slightly. Sarah recognized it as the subtle Cthar indicator of reluctant concession. Very well, he said after another long moment. But if at any point your vital signs indicate increasing distress, we will immediately implement our standard emergency protocols. That's fair, Sarah agreed, relieved when the restraint field dissipated, allowing her to sit up on the diagnostic bed. The medical bay doors slid open as Lyra returned, carrying Sarah's compact field medical kit. The other students watched with undisguised fascination as Sarah accepted the kit and placed it beside her on the bed. To their credit, none of them had left despite what must have been a distressing scene by their standards. The sight of freely flowing human blood would be particularly shocking to a species whose physiology made such bleeding immediately life-threatening. Thank you, Lyra, Sarah said, opening the kit to reveal a neatly organized collection of surprisingly low-tech medical supplies. Antiseptic wipes, gauze pads, adhesive closures, a small suture kit, and various other basic first aid items. I'm going to clean and close this wound using manual techniques, she explained, deliberately adopting the tone she used when teaching emergency medicine to new recruits. This is standard procedure for minor to moderate lacerations in human emergency care, especially in field conditions where advanced medical technology might not be available. She selected an antiseptic wipe and thoroughly cleaned the wound and surrounding skin, explaining each step as she worked. The first priority is removing potential contaminants to prevent infection. Human skin naturally harbors numerous microorganisms that can cause problems if they enter the bloodstream through an open wound. The Cthar students edged closer, their initial horror apparently giving way to scientific curiosity. Sarah noted with satisfaction that several of them were recording the procedure with small devices similar to tablets. This particular cut is deep enough to benefit from sutures rather than adhesive closure, Sarah continued, opening her suture kit. Proper wound closure reduces scarring and speeds healing by maintaining the edges of the wound in close approximation. She could almost feel the collective intake of breath as she prepared to suture her own wound. To the Cthar, the idea of deliberately pushing a needle through skin must seem barbaric. Their own medical philosophy emphasized non-invasive techniques whenever possible, a necessity given their fragile physiology. This might look painful, Sarah acknowledged as she prepared the curved suture needle, but human skin contains fewer nerve endings per square centimeter than Cthar tissue. The discomfort is minimal and well worth the improved healing outcome. With practiced efficiency, Sarah placed 5 neat stitches along the length of the cut, tying each one securely before moving to the next. She was aware of the complete silence that had fallen over the medical bay as the Cthar watched this display of what must have seemed like extreme self-surgery to them. The holographic displays continued to monitor her vital signs, showing no significant stress response, further evidence that this procedure was indeed routine for her. The final step is applying a protective covering, she explained, selecting a sterile gauze pad from her kit. This prevents environmental contaminants from reaching the wound while it begins the healing process. She secured the gauze with medical tape, then flexed her arm gently to demonstrate that the injury had minimal impact on function. Treatment complete, she announced, looking up at her audience with a small smile. Total elapsed time, approximately 4 minutes. Expected healing time without complications, 7 to 10 days. Thank you all for your patience. For several seconds, no one spoke. Then, surprisingly, it was Forlag who broke the silence. The monitors confirm no significant elevation in pain response or stress markers throughout the procedure, he noted, his tone suggesting he was having difficulty reconciling this observation with his understanding of traumatic injury. And the bleeding has stopped. Human blood contains platelets that initiate clotting almost immediately upon injury, Sarah explained. Our bodies are well adapted to managing this type of minor trauma without technological intervention. Lyra stepped closer, her eyes fixed on Sarah's bandaged arm. But surely the manual suturing technique introduces additional trauma to the surrounding tissue? Our protocols specifically avoid any intervention that might cause secondary damage. A valid concern for Cathar physiology, Sarah acknowledged. Human tissue is more resilient to mechanical stress. The minor trauma of suturing is far outweighed by the benefits of secure wound closure. In fact, studies have shown that manual suturing often provides better cosmetic and functional outcomes than adhesive closure for wounds of this size in humans. One of the other students, who had been silently observing until now, suddenly spoke. Your medical kit contains no pain management technology. Did you not experience discomfort during the procedure? Sarah nodded, appreciating the question. Some, yes, but human pain tolerance varies widely, and those of us in emergency medicine typically develop the ability to compartmentalize pain responses, especially for minor injuries. In field situations, we often prioritize treatment over comfort. Forlag had been studying the holographic displays, which still showed detailed imagery of Sarah's arm, now including the sutures visible beneath the skin surface. The imaging confirms that the bleeding has indeed ceased and the wound edges are properly approximated, he admitted, sounding faintly surprised despite himself. The technique, while unconventional, appears to have achieved its intended purpose. Different approaches for different physiologies, Sarah repeated her earlier point. What will be dangerous for a Cathar is often routine for a human. Understanding these differences is exactly why the exchange program was established. A notification chimed softly, and the amber emergency lighting returned to normal. The medical bay's automated systems had apparently downgraded the situation from an emergency to a routine medical event. The surgical robots retracted into the ceiling, and several of the Cathar medical team began quietly dismantling the emergency equipment they had prepared. Forlag straightened to his full impressive height, clasping his hands in what Sarah recognized as a formal gesture. Taryn Jenkins, I believe I owe you an apology. Our diagnostic protocols are clearly not sufficiently calibrated for human physiological responses. This incident has identified a significant gap in our medical knowledge. Sarah slid carefully off the diagnostic bed, testing her arm with a few gentle movements. No apology necessary, senior instructor. Medical professionals everywhere share the same goal: proper care for our patients. Today was simply an opportunity to compare different approaches to that care. A diplomatic assessment, Forlag replied, the faint twitching at the corners of his mouth indicating what passed for a Cathar smile. Nevertheless, I believe this experience warrants further discussion. Perhaps you would be willing to provide a more comprehensive overview of human emergency medical protocols for the students, with particular emphasis on the assessment criteria used to determine appropriate treatment levels. I'd be happy to, Sarah agreed, surprised and pleased by the request. It was the first time since her arrival that any of the Cathar medical staff had explicitly sought her input as an educator rather than merely observing her as a curiosity. The formal conclusion of the incident seemed to release the tension in the room. The students began quietly discussing among themselves, several casting interested glances towards Sarah's field medical kit, which remained open on the diagnostic bed. Lyra in particular seemed fascinated, leaning closer to examine the simple tools that had so effectively addressed what the Cathar had perceived as a serious medical emergency. May I? Lyra asked, gesturing toward the kit, but careful not to touch anything without permission, a fundamental principle of Cathar medical etiquette. Of course, Sarah replied, stepping aside to give the student better access. Most human field medics carry something similar. The contents vary somewhat based on specialty and deployment scenario, but the basics remain consistent. tools for wound cleaning and closure, pain management, immobilization of fractures, and management of respiratory distress. As Lyra examined the contents with obvious curiosity, the other students gradually drifted closer, their initial horror apparently transformed into scientific interest. One of them pointed to the suture kit. These implements appear remarkably simple compared to our tissue joining technologies. Do all humans possess the manual dexterity required to perform such fine manipulations? Not all, Sarah admitted. It requires training and practice. But the basic techniques have remained largely unchanged for centuries because they work consistently well, even in adverse conditions where power might be unavailable or equipment might malfunction. Another student tilted his head in the Cathar expression of puzzlement. But surely as your technology advanced, these manual methods became obsolete? Our historical archives suggest that human medicine once relied heavily on such techniques, but evolved toward automation as your civilization developed. Sarah considered how to explain what must seem like a paradox to the technology-focused Cathar. Human medicine incorporates technology where it provides clear benefits, certainly. But we found that maintaining proficiency in manual techniques provides crucial redundancy. A surgeon who can only operate with robotic assistance becomes helpless when that technology fails. A field medic who can adapt to available resources can save lives in any environment. Forlag, who had been quietly observing this exchange, suddenly issued a sharp command in the Cathar language. The students immediately stepped back from Sarah's medical kit and resumed more formal postures. "We have taken enough of Taryn Jenkins' time," he stated. "She requires rest to facilitate recovery from her injury." Sarah suppressed a smile at what was clearly Forlag's attempt to be considerate of her condition, despite all evidence that she was perfectly fine. "I appreciate your concern, senior instructor, but I'm fully capable of continuing my duties. This type of injury doesn't significantly impact function for humans." Forlag's vertical eyelids blinked rapidly in what Sarah had learned indicated mild distress or confusion. "Nevertheless, our medical protocols dictate a recovery period following any treatment involving tissue disruption. Perhaps we might reconvene tomorrow for the educational session we discussed." Understanding that Forlag was struggling to reconcile his ingrained medical protocols with the reality of human resilience, Sarah nodded graciously. "Tomorrow would be perfect. It will give me time to prepare appropriate teaching materials." As the students filed out of the medical bay, Lyra lingered behind, waiting until the others had left before approaching Sarah again. "Taryn Jenkins," she began, her voice lower than usual, "I found your demonstration most illuminating. The directness of your approach suggests an efficiency that our procedures sometimes lack." Sarah raised an eyebrow, surprised by this admission. "Different doesn't always mean better or worse," she replied diplomatically. "Your medical technology is incredibly advanced and perfectly suited to Cathar physiology." "Yes," Lyra agreed, "but today's incident suggests a certain inflexibility in our thinking. When confronted with an unfamiliar biological response, we defaulted to our established protocols rather than adapting to the specific needs of the patient." She glanced toward the door, as if ensuring they wouldn't be overheard. "I have been studying the historical archives of human medicine. Your species' adaptability in crisis situations is remarkable. I believe there is much we could learn from your field medicine approach, particularly for our emergency response teams operating in diverse environments." Sarah felt a surge of hope at these words. This was exactly the kind of cross-species exchange of ideas that the program had been designed to foster. "I'd be happy to share more about human emergency medicine techniques. Perhaps we could arrange some practical demonstrations as part of tomorrow's session." Lyra's eyes widened slightly, the Cathar equivalent of an enthusiastic nod. "I will suggest this to Senior Instructor Forlag. He values efficiency above all else. If we can demonstrate that certain manual techniques offer advantages in specific scenarios, he may be receptive." The following day, Sarah arrived at the medical bay to find it transformed. The central area had been cleared of its usual diagnostic equipment and instead contained several tables bearing what appeared to be synthetic tissue models of various alien anatomies, including human. Forlag stood at the center, surrounded by not only the students from yesterday's class, but several additional Cthar medical personnel. "Ah, Taryn Jenkins." Forlag greeted her with formal courtesy. "We have prepared for your instructional session on emergency field medicine techniques." After reviewing the medical scanner data from yesterday's incident, the Medical Education Council has expressed interest in incorporating certain human approaches into our emergency response protocols for non-Cathar patients. Sarah tried to hide her surprise at this unexpectedly positive development. "I'm honored by the interest," she replied. "I've prepared several demonstrations that I believe will be particularly relevant for field operations." Over the next 3 hours, Sarah guided the Cthar through basic human first aid techniques, adapting her instruction to emphasize aspects that would be most applicable to their particular challenges. She demonstrated wound, cleaning, and closure techniques on the synthetic models, explaining the principles behind each method and the scenarios where they would be most appropriate. To her delight, the Cthar proved to be attentive and surprisingly adaptable students. Though their thin fingers struggled with some of the manual techniques at first, they approached the challenge with the same precision and dedication they brought to their technological medical practices. Lyra in particular showed an aptitude for the hands-on approach, quickly mastering basic suturing techniques that many of her classmates found challenging. "The key difference in philosophy," Sarah explained as she demonstrated how to improvise a splint for a fractured limb, "is that human field medicine assumes limited resources and unpredictable conditions. We train to adapt to what's available rather than relying on specific equipment. This approach seems inherently imprecise," one of the senior medical officers commented, watching as Sarah secured the splint with torn strips of fabric rather than the molecular bonding agents the Cthar would typically use. "It is," Sarah acknowledged freely. "But in emergency situations, functional imperfection is often better than waiting for ideal conditions. A properly immobilized fracture, even with improvised materials, prevents further tissue damage and reduces pain until more sophisticated treatment is available." As the session continued, Sarah noticed a subtle shift in the atmosphere. The initial skepticism of many participants gradually gave way to genuine interest as they recognized the practical applications of these seemingly primitive techniques. Even Forlag, who had started the day with polite but obvious reservations, began asking insightful questions about how certain techniques might be modified for different physiologies. By the end of the workshop, several of the Cthar were practicing basic bandaging and splinting techniques on each other, something Sarah would never have expected given their cultural aversion to physical contact and their extreme caution regarding their delicate tissues. Lyra had organized a small group practicing suturing techniques on the synthetic models, her slender fingers now moving with surprising confidence as she demonstrated the procedure to her peers. "Your methods contain a certain elegant simplicity," Forlag commented as they observed the students' practice. "While our technological approaches offer precision and standardization, I can now see the value in maintaining proficiency in these manual techniques, particularly for emergency response teams operating in diverse or resource-limited environments." Sarah nodded, grateful for the acknowledgement. The best medical practitioners understand both when to rely on technology and when to trust their own hands and judgment. Neither approach is inherently superior. They're complementary. Forlag was silent for a moment, his large eyes fixed on the students as they practiced. "Perhaps," he finally said, "our medical education has become overly specialized, Taryn Jenkins. We have pursued technological perfection at the expense of adaptability. Your demonstration today suggests that our emergency protocols might benefit from incorporating certain manual contingencies." Over the next several weeks, Sarah's role aboard the Stellaris evolved dramatically. What had begun as a largely observational exchange transformed into an active collaboration as she worked with Forlag and the medical education team to develop a new training module focused on multi-species emergency response techniques. The module incorporated elements of human field medicine adapted for Cathar practitioners, with particular emphasis on resource-limited scenarios and physiological diversity. Lyra became an unofficial liaison between Sarah and the Cathar medical community, her natural curiosity and quick mastery of the manual techniques, making her an ideal demonstration assistant. Together, they conducted a series of workshops for various departments of the ship's medical staff, gradually breaking down the initial resistance to what many Cathar had initially dismissed as primitive approaches. 6 weeks after the incident that had started it all, Sarah stood in a newly configured training room, watching as a group of Cathar emergency response specialists practiced wound management techniques on a variety of synthetic alien tissue models. The room bore little resemblance to the sterile, technology-dominated environment she had first encountered. While advanced Cathar medical equipment was still present, the space now also contained storage units filled with more basic supplies, bandages, splints, manual suturing kits, and other tools that would have been familiar to human field medics. The Biological Resilience Assessment Module has been formally approved for implementation across all Cathar medical training facilities, Forlag announced as he joined her at the observation platform. The Medical Science Council was particularly impressed by the data showing improved outcomes for non-Cathar patients when emergency responders incorporated these adaptive techniques. Sarah smiled, watching as Lyra confidently guided a group of students through an improvised pressure bandage application. I'm glad to hear it. Recognizing and respecting biological diversity is essential as we continue to interact with more species. Indeed, Forlag's tone held a note of what might almost have been amusement. Though I must admit, when you first arrived aboard the Stellaris, I did not anticipate that our most valuable exchange would come from what initially appeared to be a regrettable accident. Sarah glanced down at her arm, where the small scar from that day was barely visible, a thin white line that would eventually fade almost completely. Sometimes the best teaching opportunities arise unexpectedly. My instructor back in medical school used to say that medicine isn't just about knowing the correct procedures, it's about understanding when to apply them and when to try something else. Forlag nodded slowly, a wisdom that transcends species differences, it seems. He gestured toward the training room, where Cathar medical personnel who had once recoiled at the sight of manual medical techniques were now practicing them with focused determination. Your small injury has healed remarkably well, yet its impact continues to spread throughout our medical practices. As Sarah stood watching the scene before her, she felt a profound sense of satisfaction. When she had volunteered for the exchange program, she had hoped to learn about advanced alien medical technology and perhaps share some human insights in return. Never had she imagined that a simple cut on her arm would become the catalyst for a fundamental shift in Cathar emergency medical philosophy. Later that evening, Sarah sat by the viewport in her quarters, gazing out at the star-filled blackness beyond. The Stellaris continued its research mission, a tiny speck of life and intelligence in the vast emptiness of space. Somewhere out there were countless other species, each with their own unique biology, their own approaches to medicine and healing, their own strengths and vulnerabilities. The galaxy was far too complex and diverse for any single medical approach to be universally optimal. She ran her fingers absently over the small scar on her arm, a reminder of how seemingly minor differences could lead to profound misunderstandings, but also how such moments of disconnect could ultimately foster deeper understanding. The medical exchange between humans and Cathar had taken an unexpected turn, but perhaps it had ended up exactly where it needed to be, at the intersection of technology and touch, of protocol and adaptability, of difference and common purpose. As the starlight streamed through her viewport, Sarah smiled at the thought of Lyra and her fellow students, their slender fingers learning to master techniques that humans had used for centuries. Sometimes, it seemed, the most valuable innovations weren't about creating something new, but about rediscovering the enduring wisdom in something old. And sometimes the best way to move forward was to reach back, finding balance between technological advancement and the fundamental connection of one being helping another with nothing more than knowledge, skill, and their own two hands.